pansexual for those who might be.
Mm. That's I don't know if I have a real answer there. I think that that is uh, really the company or the purview of people that are identifying in that way, that you tell me what that means to you. I think that if you asked people that identify as heterosexual, truly, bottom line, what that means to them, you would get some variation on an answer. So I think the broadest thing I can say is pansexual folks don't cap it off at the binary, at male and female. They're looking at entire persons and more heart resonance than gender or sexuality in that way. Um, Although there are physical preferences, as was said before. So it's not everybody. It's some variation of who folks might enjoy being with, but viewed on an individual level.
Yeah. And speaking about defining yourself, there's an article called "What is Pansexuality," which is featured on Teen Vogue, where they highlight some quotes from young people on how they define being pansexual.
Mm.
So I'll share a few quotes from them, and everybody who's watching can drop your comments and questions on these in the chat below. And then Dee and I will just discuss a couple of them. So one of the quotes says, "If I dig your energy, I dig you." And I feel like
Right.
that's how like when I was identifying myself as pansexual, I was always like, yeah, if the vibe is right, then like it doesn't matter like what you look like or what you identify as. If the love is there, then that's all that matters to me. What do you think
Mm.
about
Well, when I first read the question, I had to smile at it because it really so takes me back to, yes, I'm going to say it, the 70s. Because that was, even though when people were identifying their primary identity was heterosexual, that was still the vibe of it. It's like I don't have a set, that's my type. It
Mhm.
was more, it felt more open. And a lot of folks came out in that space of openness, sexual openness, or at least the at least a vision of sexual openness. I don't know how genuine any of that was now, but that's my experience of it. And it would be, I think, if that was how we led, regardless of who we were attracted to, that would lead to better communication, great conversation, which is what you need to have safer sex, safer relationships, all these things. We need to really know who we're working with. So,
Yeah.
yeah.
Another one of the quotes was, "I never want to alienate anyone in my sexual expression."
Mm.
Feel like you just touched a little bit on that. Because I feel like when people are choosing to identify as pansexual, a lot of the times they're opening themselves up to not like keeping anyone out of their view of who they could be attracted to or want to be in a relationship with.
Mm. Yeah, I, let me see. Where is that quote again? Where is that? I don't know about the alienation part. I read that and I felt like, well, if my sexuality my expression alienates somebody, I'm sorry about that. But if I'm some kind of way about it, I can't really help that. I certainly don't want to draw all energy because of my own identity. I don't want to draw all energy into me. That would be not very genuine. I can't flirt with everybody. I can't be open in that way and don't really desire to. So, I can understand how that can be a feeling one holds. It just, I'm working with the word alienation. Yeah.
Hmm.
Mhm.
And what about this last quote? My sexual attraction is not based on gender assignment or gender expression.
Hmm. 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 I think in a world without a lot of stigma, without the stigma we work with, this, I think most people would ride somewhere right here in the middle. It doesn't mean that we would then actively seek a sexual relationship with whoever, but I think the ability to be attracted, to find, to see what is attractive to us is human and far more prevalent than we allow it to be. You know, if you find somebody attractive or something attractive and there's consent, then
Yeah,
what's the hassle? What's the problem?
yeah,
Yeah.
exactly. Um, Another great point that was highlighted in the Teen Vogue article is that there is no one definition of pansexuality, and that identifying as pansexual or any sexual identity does not communicate what types of sex or sexual practices you consent to engage in to your romantic, sexual, or relationship interests. So it's important to
Hmm.
have conversations around sex with your partners, and talking about sex doesn't seem like a tool that you can use in your sexual health toolkit, but it is, and I think it's one of the most important ones.
I think it's the best one you have in essence. I mean, if you think about sexuality and as an encounter as something that exists on an arc, having that initial conversation is part of how you get started. How do I look in your eyes? How do I communicate with you? How do I get to know you on whatever level we choose to? There has to be some spark, some communication happening. And if I can do that, then I can share what my risks are. I can ask you questions about what your risks are, and we can genuinely talk about what it is that we want to do together. What behaviors do we want to have together and have nobody be ashamed or afraid within a sexual context. And that way our risk for STIs, for HIV, for unplanned pregnancy is something that we can be ready for instead of having stuff just happen to us. It
Yeah,
shouldn't just be happening.
yeah, exactly. So make sure you guys are having these conversations and you're looking for as many resources as you can to keep yourself healthy and safe. Um, so if you need any help thinking through that or adding more to your sexual health toolkit, you can call our Whitman-Walker Community Health Team at 202-797-4439. And you can get linked to sexual health resources and gain more tools for your sexual health toolkit like PrEP. If you guys don't know, PrEP is the daily pill that can prevent HIV, which is transmitted through sex by about 99%. It's a HIV prevention option for all genders, but does not prevent pregnancy or STI. So it's important to use PrEP with other tools like contraception and barriers, like condoms.
Okay. Well, we want to talk about health outcomes and data some? Yes?
Yeah.
Or, yeah. Okay. So, well, I don't think I need to say this too much for folks, but you know that data for LGBT folks is limited. Health data is limited. Very not enough agencies ask the proper sexual orientation, gender identity questions to really put us in frame. How many of us are there and what health behaviors do we have? So we have some of that, but not enough. When we drill down to bisexual and pansexual communities, you can imagine if we're discussing language and how to identify that researchers are struggling with that as well and struggling from my experience researchers struggle with how to ask the questions and a lot of folks assume that the public will be offended by the question and frankly I think that you're putting more people out of research than you're drawing in by not identifying them. So there's that. And then what I have here is something called the bisexual umbrella. Most data reflecting the needs of pansexual communities is directly related to extended research that was done on bisexual folks. Close, but not exactly the same. And That is to say that bisexual, pansexual communities, like many sexual minorities, experience greater barriers to care and culturally competent care, of course. Um, People rarely ask about, if they ask about sexual partners, they're not asking in a way that allows people to truly express anything out too much outside of a monogamous heterosexual relationship. Places like Whitman-Walker are like water on the moon for folks, that they can come in and just be themselves, and how much better that makes an experience when you can really tell your provider what's going on with you. Um, but if you're cut off because of the lack of culturally competent care, that that access to care really drives problems that we don't need to have. So when we talk about later detection of some cancers and HPV, if that was a circumstance where we could just go to the doc, talk about our lives, those kinds of things would be caught earlier, that we wouldn't be struggling. Um, yeah, that's what I have. Okay.
Thank you so much for sharing that data, and for joining us and sharing your wealth of knowledge in general. Thank you to everybody who tuned in today. We really appreciate you all sharing this space with us and learning more about our Pan brothers, sisters, and siblings. Are there any final thoughts you'd like to share?
Well, one, thank you so much for inviting me today, and I am amazed and appreciative of a space that's created to have this discussion. You have to know how long it took us to get here, how very long it took us to get here, and I'm just really pleased that we are here now. Yes.
Thank you. I'm really glad we had this conversation. If anybody here watching is a person learning more about yourself and how you might identify, and you think pansexual or panromantic aligns with your identity, you can learn more about this community by visiting the websites for the Canadian Center for Gender and Sexual Diversity, Stanford University's Vaden Health Services, or reading the What is Pansexuality article posted in Teen Vogue. There's also a sexual orientation test at www.idrlabs.com slash sexual or dash orientation slash test.php. They ask you a series of questions relating to your sexual fantasies. And this test is just one way to explore your curiosity and discovering more about your sexual orientation, but it is in no way absolutely accurate. It's just more for folks who like additional resources to help them discover themselves. And just have conversations with people who, you might feel you can relate to and identify with, and try to create open spaces for these conversations to be had so that you're learning more about yourself and other people. Um, Make sure to follow us on IG, on Facebook, and Twitter at Whitman-Walker for the most up-to-date Whitman-Walker health information and content. And you can also tune into our youth team um, at on Instagram at Real Talk DC _, as well as our new cultural center, The Corner, which is at The Corner DC, um, for more content about what's going on with the cultural center. It'll be really, um, we're all looking forward to sharing information with you from the Whitman
Yes,
Walker Health
we will.